Hello and you're very welcome to the Health Research Podcast, where today we are looking back at the recent launch of the HRB 5-year strategy, Bringing Research to Life. I'm your host, Dr. Claire O'Connell, and in this series we explore how research and evidence can help to shape better policy and practice for the benefit of everyone. That's service users, communities and society at large. And today we're in the company of two people at the HRB who have a lot of responsibility around this plan. They are Dr. Sarah Craig. Sarah is Director of Health Information and Evidence, and Dr. Teresa Maguire. Teresa is Director of Research Strategy and Funding. You're both very welcome to the studio. Just to fill everyone in before we hear from Sarah and Teresa, we will have footage from the launch throughout this podcast, and our guests will add a bit more detail on some of the key points of the strategy. So where better to start than with Dr. Tracy Cunningham, Chair of the HRB, who opened the proceedings.
And it gives me great pleasure to invite you all here today to the launch of the new HRB 5-year strategy, Bringing Research to Life. As the HRB marks 40 years of public service, this strategy represents our ambition and drive to strengthen healthcare on the island of Ireland through a dynamic health research ecosystem. This morning, you will learn about the strategy from senior leaders in the HRB. You will also hear directly from some of the people who have been part of our current strategy and will play an important role in delivering on our new ambitious strategic programme. Collaboration and partnership in all research is essential. This 5-year strategy was developed in partnership with the Department of Health, as well as with other government agencies, our research community and the public.
So that was HRB Chair, Dr. Tracy Cunningham, and Tracy was outlining the overall thrust of the strategy at the launch. So let's talk about making things happen, because while it's one thing to have aspirations, it's quite another to crystallise them into a practical strategy. I suppose it's a bit like the swan, sort of serene on the surface, but beneath there's intense paddling going on. So maybe we could talk a little bit about what the HRB had to do to create this strategy in the first place. Teresa?
Yes, Claire, you're absolutely right. It did perhaps look serene at launch from the surface. I think it's fair to say that the work that led to this strategy really started in 2024 with discussions of the senior management team and the board in the HRB, and a lot of workshops and engagement with staff. Staff have executed the last strategy and many of the strategies before that. They are the pulse in listening to our stakeholders on an ongoing basis, not just at strategy development.
They have
period.
A lot of experience.
So they have a lot of experience, and they shared and inputted a lot of experience. And that was great as a process, and I think is shown in the outcome. But like all strategies, it's really, really important that we listen to our stakeholders, that we engage with them, and that we were in listening mode. So I think 2025, I would really describe the whole of 2025 as being in listening, consultation mode. Our key stakeholders, I think probably to most people, the clues in the name for the Health Research Board are pretty obvious. Department of Health, HSC, HICWA, and others. But of course, we function within a research system as well, speaking from my own perspective, certainly. So departments like TFERIS and other research funders like Research Ireland and so on, we engaged heavily with them. And because we really felt strongly in this strategy, I suppose probably the biggest innovation, if you want to call it that, in consultation was the staff felt very, very strongly that the public and patients were always at the heart of everything that we do, that was going to be carried forward into the next strategy, this new strategy. So we established a public and patient reference group to input to the design and the prioritisation and the discussion of our strategy, and they met throughout the process.
Great,
so,
I'm glad to hear it. Yeah.
And that was really invaluable. I think it was important, and it's easy to say these things and to preach to others, but we felt we would lead by example, and thought that would really crystallise and make our strategy more relevant, more impactful, and just help us maybe to avoid maybe some blind spots that we might have.
And Sarah?
Well,
from the point of view of the health information and evidence side of the HRB's work, the consultation was really key to involve quite a number of people, for example, in HICWA and in the HSE. There's a lot of, work going on around digital transformation within the HSE. So we really had to work with a number of the kind of key units within the HSE to really learn from them about the whole context for that digital transformation. And that was really useful in helping us to shape what we have in terms of the goals and objectives today.
Very
Absolutely.
good.
And it would be remiss of me, Claire, not to mention particularly as you kindly assisted us in early 2025, I think the kickstart for all of it on the Bank of Staff was our grant holders conference in February 2025. And I think, that 1.5 days of locking yourself in a room in the middle of the country with your research community, but also not those who perform research. But again, we had other stakeholders like other funders, other partners from the charities, and people from the university research offices and the host institutions, and we had our all-island partners and so on.
And so how do you go about implementing the strategy then? Once you have you have it down on paper now, you know the direction of travel, how do you actually do it?
Well, all through the strategy planning process, we had a strategy steering group, which really was made up of the senior leaders in the organisation and a number of other business leads. And that was really useful to bounce ideas around, make sure that we're all on the one page and make sure that we're following the plan as we had set out. Following the launch of the strategy, that group has morphed into an implementation planning group who will now look at developing the plan for the next 5 years, developing KPIs and looking at how then we monitor and evaluate our progress as we go through the next 5-year period.
Yeah. Now let's have a look at some footage from the launch where the HRB CEO, Dr. Gorman, gave a presentation outlining the strategy, and then Sarah and Teresa, you might flesh out a few points afterwards.
But the best way I can explain what we want to achieve is through the values that underpin our strategy. They're not abstract words in a document. They're the principle that guide us as a research funder, as a steward of National Health Information System, and as a trusted partner to the government, the social care system, to the research community, and really to the people across the island of Ireland. So let's start with impact, because that's ultimately why we exist. Everything you've heard today, the case studies, the partnerships, the evidence feeding into policy and practice, really points to research that really delivers real impact. Over the next 5 years, impact will mean more people accessing clinical trials. It really does making better use of our data and improve services. And it means evidence that is timely, trusted and usable, particularly when decisions need to be made with urgency. But as you all know, impact doesn't happen automatically. We must work at translation, knowledge brokering, and build strong connections between research, policy and practice. That is central to our strategy. And impact doesn't really work if we don't bring people with us. The clearest message we heard shaping this strategy is it works best when we're collaborative, when people are heard, respected and involved. We in Ireland can be very proud of our PPI involvement, and we really are committed to building on that. Not just by involving people in research, but doing research with people, from shaping the questions through governance to how findings are actually communicated and used. Inclusiveness also shapes our policy and strategy across disciplines and sectors. Respectful collaboration will be essential as we respond to increasing complex challenges in front of us. Equity is also another topic on our slide. It's certainly not lip service. It runs right through the strategy from start to finish, because we know health and well-being are shaped beyond just healthcare. Socioeconomic disadvantage, gender, disability, migrant status and geography all influence our health and access to care. This strategy prioritises research that will help us understand and address those inequalities. Equity will also shape how research is designed, governed and applied, so the evidence we generate will reflect the lives and needs of those it's supposed to serve. Let's look at leadership next. At the HRB, this isn't a hierarchical concept. It really is by convening, enabling and setting directions together. We'll continue to lead national investment. We will also work closely with our government and policy departments, with the HSC, our academic colleagues, charities and all partners across the island of Ireland and beyond. But leadership also means stewardship of public funds, of data, of the well-deserved trust that the HRB enjoys. We take very seriously our responsibility to derive value for money, for system efficiency, and responsible use of emerging technologies such as AI. Trust can never be taken for granted. I've heard it said, trust comes in on foot but goes out in a rocket. Integrity matters and has been central to the HRB and remains central to this strategy. As we mark our 40th birthday, that commitment is as strong as ever. Maintaining trust is about accountability and transparency, making knowledge accessible beyond policy and academic circles, communicating clearly to the public. It also means upholding high ethical standards, safeguarding consent and privacy, and protecting public interest in an evolving research landscape. If recent years have taught us anything, that the health research landscape can really change rapidly. This strategy is ambitious, but designed to be flexible. It allows us to adapt to emerging health threats, new technologies, and changing policy needs. Innovation is just not about funding new ideas. It's about how health systems work, simplifying processes, using data more effectively, reducing research waste, and getting evidence as quick as possible to decision makers. Agility will be a defining strength in the years ahead.
And that was Dr. Gráinne Gorman, who is CEO of the HRB. So, Teresa, a lot of emphasis there on that public consultation that you were mentioning. I suppose working with patients rather than on them. And of course, we'll return to that subject a little bit later in the podcast. But perhaps you might explain to our audience your job at the HRB. You've already alluded to some of the work you're doing at the moment, but how some of what Gráinne was saying will be your responsibility.
I have responsibility, I suppose, on behalf of the board and on behalf of the department to essentially decide where our research funding goes. So it's quite external facing, and we so heavily involved in the consultation and the strategy and the engagement process to decide on those goals in the first place. But they are big, high-level, ambitious goals, and we need to have priorities and objectives and very clear deliverables within that. So I work with the team in the HRB to determine what they are, to set out what would success look like for that, who do we need to work with, what resources, and so on and so forth, and to put funding instruments, to action a blend of funding instruments that will deliver across the 5 goals, essentially, of the strategy. So that's very much about trying to determine both the prioritisation and the phasing and the interplay between those 5 goals. What will we do and when, and how much budget will we allocate to each of those? So lots of discussions with the board, as you can imagine, about that, and indeed with the Department of Health. But it's also a key part of my role would be making sure, in the spirit of maintaining trust and transparency and accountability, and really ensuring that the type of research that we fund and the environments that we're funding it into are comply with high ethical standards and have a healthy research culture. So things like ethics, research integrity, research security, open science. We need to make sure that these are in place. So how we're funding is always to the forefront of our mind, and our policies and our practices and our systems and our engagement around that, as well as what we fund, because together is where you get the impact. What does that mean in practice in terms of delivering the strategy? Well, you've touched on some of the points that Gráinne made there in the strategy launch. And so I would try and support a team who are looking after clinical trials. Very interesting juncture for clinical trials. The HRB has long invested in this area, but we will soon have a new National Clinical Trials Advisory Council trying to deliver on the Programme for Government commitment to increase the number of trials that are ongoing in Ireland and access for patients. And so I think the HRB will play a leadership role in this, building on what we have done in the past. Gráinne touched on data. This is something that spans the organisation, and Sarah will talk about that from the information systems perspective. But as a research funder, we have, over successive strategies, really encouraged people to not, if there is existing data there, to try and answer questions using existing data rather than always going, we'll do more research.
De novo.
And the whole issue of access to that data, navigating some of the challenges, perceived or otherwise, sometimes around GDPR and some of the risks around that. We've tried to support the research community to do that and put special funding out to really encourage and promote people to do that. And it's an area that we've seen great success on. And being able to answer questions we would never be able to answer through primary research. And particularly where we can link data sets from around the country. So that is something that we're really, really excited about as we move into this strategy, because we have the European Health Data Space is the first data space coming from Europe, move towards having a health data access body where people can apply to access and get linked data in a secure portal, navigating all of those constraints and barriers that have been there to answer questions for policy and practice, but also for research.
Yeah. So Sarah, can you tell us a little bit about your role at the HRB and some context to some of the key points from the strategy that you'll be working on?
Yeah, sure, Claire. As Director of Health Information and Evidence, I have responsibility for two key areas within the HRB: the health information function, which is managing 4 national health information systems in the areas of mental health, disability, drugs and alcohol treatment, and drug-related deaths. So we're producing on an ongoing basis information and data really to inform policy and practice in those key specialist areas. Teresa's already, I suppose, mentioned what's happening at European level. So not only are we wanting to drive that agenda, but also as data holders, where we sit in the HRB, having best practice, ensuring that we are fit for purpose so that our systems can be part of the broader health information infrastructure. So there's been a lot of kind of preliminary work around that, but we do see over the next 5-year period that we will grow our infrastructure. We will look at the technology. We will look at even the areas in which we are currently collecting data for the department and the HSE. The second bit of the work is the evidence centre, and really both the health information and the evidence fit within the goal 3 of our strategy, which is about data and evidence for policy and for practice. And so our evidence centre is undertaking evidence synthesis, evidence reviews, rapid reviews, which all feed back into the Department of Health and inform their policy and practice discussions. So over the next number of years, again, we want to grow that area of the HRB's work. And I suppose it's fair to say, whilst we describe them somewhat separately, there's a huge overlap in terms of the work of the 2 directorates in delivering on the kind of key strategic goals as they're set out.
Yeah.
Yes.
Very good.
And a very particular initiative that we have just funded at the start of this year, and a flagship as part of this strategy, is an evidence synthesis hub who will work to the Chief Medical Officer on behalf of government
Okay. Yeah.
to bring rapid reviews, more rapid than people have called rapid reviews in the past. We could be talking days, we could be talking weeks.
Yeah.
In preparedness for us needing to respond to a pandemic or some other public health threat. So what we have done in a nutshell is we've like thrown a net over our own evidence centre, Evidence Synthesis Ireland, HICWA CISER and others, and networked. That network brought them together and said, you're going to work together on new protocols, you're going to be inventing new products that you can do in 3 days and 5 days and so on, and you're going to work directly to a governance structure of government who will ask questions of you. And rather than wait for the next COVID or the next pandemic, that is now operational on, I'm going to call them simulated urgent questions.
Yeah.
We've had
building up that
we've had
muscle.
monkeypox. These are not simulated. We've had hantavirus. There are many pieces of public health evidence. They may not be described as crisis mode, but we could do with the evidence on them, and they're going to be used to simulate what can be pulled together. And there's a very particular focus on that, on AI-enabled rapid products.
Sure, yeah.
Do they work? Are they acceptable
Yeah.
to policymakers? Does the quality of evidence? So there's many layers to this, and also because something like that is global, we're working with other networks who are doing the same things in other countries.
We saw during COVID the importance of having those networks, particularly around clinical trials, and how you get the power of the numbers.
Having good data that
having
you could
good
rely
data.
on.
It's all about the good data.
Absolutely.
Now, Minister for Health, Jennifer Carroll-MacNeill, launched the HRB strategy, and she gave us a bird's eye view of how the HRB's work over the next 5 years will impact policy and practice across government and wider society. In a wide-ranging speech, she touched on Ireland's presidency of the EU, medical devices regulation, the Biotech Act, due to come into force at the end of the year, and a whole lot more. So again, we'll take a listen and have some observations from our guests. But for now, over to the Minister.
It's a wonderful year for the HRB, being 40 years old. And if I may say, never has science become more important and more contested. And as you go through today, I just love, there's nobody in this room that's contesting those concepts, but as a public representative and as somebody who's very much hearing a different discourse in the world, asking you to reflect on the position of science and the position of research in a slightly different way, in a way that I know that you shouldn't have to, but perhaps we'll just touch on those themes as we go through. I mean, since 1986, since the HRB was established, it's played a unique and a really, really important role in that regard, building a world-class health research system that informs policy, that supports discovery, supports innovation. But it's also now important that we reflect on what is the science environment, what is the research environment now in the 40th birthday of the HRB, and now as you launch the statement of strategy or the strategy for the next 5 years. The new strategy sets out a very ambitious vision. Of course it does. This is Ireland. We are ambitious. It sets out an ambitious vision for the next 5 years that will strengthen our health research system, deepen its impact, and ensure that research continues to impact and improve lives and improve patient lives, help avoid illness, help improve people's lives, the way in which they live with illness, the way in which they recover from illness. It's a deeply, deeply practical working out of the research. And again, I always thank you for that, and always thank you for the contribution that your dedication to research makes to the people whom you will never meet who will benefit from it. And you must never ever forget that in the context of research, particularly health research. The HRB funds and supports and collaborates with outstanding research, outstanding ideas, outstanding innovation to improve health and social care and support in our economy. But more than that, it connects Ireland with the research communities around the world. And that's something that we need to lean further into for two reasons. Again, one, to simply get better research outcomes, better collaboration opportunities. But two, again, and I can't state this more strongly, I just have a strange feeling about it, to really ground the value of science, the value of research in a social context at a time that it should not be a contested concept, but has become a contested concept in a very short period. So how we do that and how Ireland is positioned from a research perspective, from the value of science perspective, how that links in for the value of research for its own self, of course, but also how it links with the development of our health, but the development of our economy and our society as well, which is just as important in supporting the sort of the centrist democratic principles that underpin the values of research. It's so very important now more than ever.
And that was Minister for Health, Jennifer Carroll-MacNeill, concluding with the social importance of the HRB beyond the core functions of funding, research, evidence and networks. Sarah, any thoughts?
I think the minister's kind of focus on trust is a really important one for the HRB. I think we have been regarded for some time as a trusted source of data and evidence for the department and for other stakeholders. And I think in the new strategy, the plan is to grow that trust and to grow our independence as an agency that is involved in the provision of data and evidence, but also in funding key research areas that are of relevance to the department itself. So for me, trust and independence go hand in hand, and the minister certainly focused on those in what she said.
So as we know, research needs to be with and for the public and patients. So let's talk a little bit about the public consultation aspect of the new strategy, formerly known as Patient and Public Involvement, or PPI. At the launch, Trinity College Professor of Geriatric Psychiatry, Iracema Leroi, who is project lead for the Emerald Lewy Body Programme on Dementia Care, was joined by Eben Stewart, chair of its PPI panel. And together, they gave us an insight into how PPI works in practice.
Dementia has had a huge impact on our family life. As I've lost my mother and my wife to dementia. They're still with us, but they're in the later stages of the disease, both of them. So I felt I had to do something positive. I had to be involved, doing my caring role during the day or later on in the day. I have space for that, but the other time I need to feel that I'm doing something to help the community, the community at large.
Fantastic. And your input has been absolutely huge. And in talking about all those steps of the research cycle, you and your PPI peers have fed into every aspect of our research programme. But from your perspective, what do you think has been the biggest impact you've made to the research that we're doing?
Well, I suppose our lived experience, our group have a lived experience, which is almost like a qualification in itself. We are the ones who live it. We live it every day, and we can bring that experience and to the group, to the PPI. And I suppose what I have found extraordinary is how we feel listened to and appreciated, and everything we give is valued. So we're operating on the same level. So it's not clinician there while we're just tokenistic. It's not a tokenistic relationship, not at all. So I think just to feel that, because I was a teacher, so I'm used to talking to groups who are not listening to me. So it's quite a unique experience to talk to people who are actually listening and appreciating. Like that's new to me. So I'm enjoying that.
So Eben, thank you so much. Your input and that of the group has been absolutely huge in terms of shaping the work that we do at so many different levels. Tell me, do you have any advice for researchers as well as our funders, the HRB, about how we can more meaningfully engage with PPI and how we can really centre it in the work that we do?
Well, I think I've kind of mentioned it, that the main thing is to listen to the voice of the experts in that particular field, which is the lived experience, and to, as much as possible, put into action the feedback you're getting, that it is translated into actions, and that and to give hope to the community, for us it's the dementia community, that we will find answers, and we will improve outcomes for, it's not just the patients, but the families, because it is a devastating disease which affects everyone in the family. But we've created a community as well, which is great, that what people just want is to be heard, obviously, and to feel that there are other people living with the challenges that we live with. They just want support. And by working within a PPI group, they get that support. Like they'll often say when they come to our meetings, that the best part of the meeting obviously is meeting the clinicians, but also just the coffee afterwards and just having a chat and just sharing our different challenges and swapping numbers, and that makes PPI human. It's real and it has a huge effect.
Well, we have just heard a powerful perspective on the real life value of PPI. Teresa, you might fill us in a little bit more on how PPI works, the different forms it can take and how it can influence outcomes.
Yes, I mean, the core idea is simple. It's certainly easy to say, Claire, in that research is better when the people that it is meant to benefit and serve are involved in the design, the guidance and the interpretation of it. So we are looking at people with lived experience, whether that be patients, service users, families or the public more generally, participating and shaping research. That can be priority setting, helping to identify what are the questions that matter. It makes them more real world. It could be sitting on contributors, sitting on advisory groups, governance groups, steering groups, and staying for some or part of or all of the project right through to dissemination, interpretation of the findings, sense checking them and adoption. It could be for a funder like ourselves, PPI contributors sitting on our assessment panels.
Absolutely. Now, we've heard some of the speeches and presentations from the launch event, but there were also some experienced research leaders in the audience, and we managed to capture some of their thoughts afterwards. Here's Mark Lawler, Professor of Digital Health and Chair in Translational Cancer Genomics at Queen's University Belfast.
North-South is incredibly important. We've shown, for example, in cancer, that if you work with a collaborator in Northern Ireland and the Republic of Ireland, you actually get better, more impactful research and impactful papers. One of the great things in this strategy, it gives an opportunity for shared learning, and particularly in the area of using data to both understand disease, but also using that to influence, to deliver better impact. And there's nothing better than working together cross-border. So cancer knows no borders, data should also know no borders. And if we can work together, I think we can really achieve something special on this island.
And now let's hear from Professor Helen Whelton. Helen is Head of the College of Medicine and Health in University College Cork. She's also the Chief Academic Officer for the HSE Southwest region.
The HRB strategy has a strong emphasis on evidence for practice. Now, this is really important because we should be practicing evidence-based care. Of course we should. So the investment in this is really important. But what is more important is to ensure that that evidence is implemented. So by focusing on evidence for policy in the strategy, it's going to really underpin the early translation of new research knowledge to practice. Historically, it's taken an estimated 17 years for new evidence to be implemented at the bedside or to the patient. This has to change, and strategies such as this new HRB strategy are set to really address this problem.
Sarah, we heard Helen there talking about the crucial importance of evidence-informed policy and practice. This is right up your street. And of course, HRB CEO Dr. Gráinne Gorman also spoke about the need for agility and flexibility in implementing this strategy over the next 5 years. So there are a lot of issues in here. It's about producing timely and sometimes rapid evidence, adapting to emerging health challenges, harnessing new technologies like AI and advanced data analytics. As someone who is responsible for ensuring high quality health data is or are collected, analysed and made available to decision makers, have you any thoughts on the points that Helen made?
Yeah, I think they're very well made in the sense that we see where we sit in the HRB as being key to really delivering high quality data and evidence into the policymakers. If I could just kind of draw a couple of examples from what we're doing currently. We're very closely aligned with the mental health unit in the Department of Health around sharing the vision and its implementation. Very much involved in national drug strategy developments and monitoring through the data that we currently collect on alcohol and drugs. Also the suicide prevention strategy. So having key information that can inform how those strategies are implemented, I think is really important over the next 5 years. Just to specifically mention our work in drugs and alcohol, because we are the the Irish focal point for the European Union Drugs Agency, and that gives us responsibilities around the provision of data and evidence in that specific area. I think that's very timely, given the EU presidency is upon us, and really being able to work alongside member states around key policy issues at that level, which will also inform policy development at national level.
And keeping with Professor Helen Whelton, let's just tune in for a moment on what she was saying about inclusion and inequality.
Extremely important in health because, of course, the marginalised in society have the poorest health outcomes. So by focusing on this in the strategy, it's set to address this issue. Also, during the development of the strategy, different groups were consulted. So their perspective is now reflected in the strategy. And that's the first step to addressing the problems.
So, Sarah and Teresa, what are your thoughts on that?
The point I'd probably add to it is we had lengthy discussions. This is something that came up repeatedly through the consultation process. It came up repeatedly through our staff deliberations. My preference, having had those discussions, is, I'm going to call it, to build on the health inequality team by talking about equity and health equity, because I think health inequality tells us about where people have different health statuses, risks and outcomes. Equity brings it one step further, putting in a health equity lens into research about why is that happening, and it gets into the issues of fairness and avoidability and what needs to change, what actions are needed to do that. Mm-hmm. So that is something that we really, really will be building into everything that we do ourselves, into our deliberations, into our criteria, and I think the research community can increasingly see that becoming part. I know they'll shudder and go more bits of forms, but I think it's really, really important. It is timely to say that it's something that the staff and the whole organisation really wanted to do something about during the strategy, was to say, how can we help to change a dial on that? How can we work with others? And so we are planning in the very near future to host an event and a listening exercise where we're hoping that by us putting a significant amount of funding on the table in the area of inclusion health, where we really start to look at people who experience extreme social exclusion, addiction, Sarah has mentioned, homelessness, imprisonment, poverty, and the intersectionality between that. We're just not seeing, because it's really, really difficult to do research in those areas. Those groups are not accessing our services. It makes research difficult in those areas. We've seen that as a health research funder. We've talked to other departments, justice and
so by providing the resources and the focus, you want to change
absolutely
that. Yeah.
So we want to invest in this space. We believe there's a change needed. We think we're well placed to play a lead role there. We want to put our money where our mouth is, but we will be doing that and saying, come join us and give us the ideas for what will change that dial, because we know it's complex. Yeah. So that's something in the very near future, and something very lasting, we hope, and to play that leadership role, but working with the policy levers are often outside of health. So this is not an unusual one for us, but it is
cross-cutting issue. Absolutely.
It definitely is.
Yeah.
So.
And Sarah, what were your thoughts?
I mean, to add to that, I mean, obviously, in terms of the the data, we have for a very long time worked with very marginalised groups. Teresa has mentioned them, in terms of addiction, people with mental health difficulties, homeless people. So we're really happy to feed in the expertise of the health information systems and evidence teams into the inclusion health piece and what that will look like and how that money will be spent, because what we want to see is better outcomes for those marginalised groups, and we need the investment to be able to do that. So that is certainly something, in the near future that will be really good.
And that's it from the Health Research Podcast. All that remains for me to do is to thank my studio guests, Dr. Sarah Craig and Dr. Teresa Maguire, and of course to thank you, our audience, for joining us. And we will leave you with the words of Professor Mark Lawler, who so eloquently summarised the reason why the HRB's new strategy, bringing research to life, will prove to be so important over the next 5 years and beyond.
This strategy has the capacity to deliver real impact, to make a difference to every single citizen on the island of Ireland. It's really important that research is at the cornerstone of how we deliver better care in the 21st century. Because if it isn't, we're not going to succeed. Research is the driver of better outcomes for patients and their families.
This podcast is a production of the Health Research Board, Ireland's state agency for conducting and funding health and social care research.